Hi, this is Mike Plackey, physical therapist and owner of Plackey Physical Therapy in El Dorado Hills, California. And today I want to talk to you about a particular treatment technique that I use called functional mobilization. Functional mobilization was developed by Greg and Vicki Johnson in Steamboat Springs, Colorado, two absolutely brilliant therapists and mentors of mine. I've been using this technique since about 1998, and I think I've used it on almost every patient on a full-time basis ever since. And it's an absolutely wonderful technique, extremely effective, and people just get better when you use it. So let me tell you a little bit about it. This video is meant for the layperson. I'm going to keep it pretty simple. I'll give you the basic idea of this technique. As a physical therapist, my job is to evaluate and improve the efficiency with which human beings move. When people have tightnesses in their body, they start to compensate and move slightly differently, and eventually their body will start to break down due to that compensation. So when a patient comes in, I evaluate their movement. I manually check with my hands how well certain structures move, whether they're joints or soft tissues. When I find something that feels absolutely tight and does not move, like I'm pushing on a wall, we call that a hard end feel or a restriction. A hard end feel is unhealthy. That hard end feel will cause compensation because that area doesn't move right there, and has a lot to do with the reason the patient comes in for their pain. So utilizing this technique of functional mobilization, I would hold that hard end feel and maintain pressure on it as the patient would do what we call a functional movement pattern, and do a movement, a number of different movements, back and forth, oscillating as I hold that tight area down. And as the patient oscillates, the pressure increases and slightly eases off, increases and slightly eases off where I'm holding on that hard end feel. So it's pressure on, pressure off, pressure on, pressure off. The patient's participating in the mobilization. I'm holding it. As they continue that hard end feel starts to soften and melt away and release. Suddenly, after a short period of time, maybe a minute, give or take, that hard end feel is now gone. It's now springy. So a very effective technique. And so let me show you how we might use that in a particular area of the body. And the brilliance of this is we can identify these restrictions anywhere, or tightnesses anywhere in the body, and treat anything in the body from head to toe, any structure really with it. But let's keep it simple and look at the lower back, and say we have a low back patient, maybe an L5-S1 disc problem. Now, with any low back patient, they're going to have tightnesses in their pelvis. And tightness in the pelvis will contribute to pain associated with a low back, say disc, or some problem with the low back. If we look here, we can treat anywhere in this pelvis in any number of ways, but let's look at the sacrum. The sacrum is this bone here, this upside down triangle. And right next door is this bone called the innominate bone here. And in between is this joint called the SI joint. The SI joint has to move well in order for the low back to be happy, or to function well also. So what I'm going to do with this patient is say, okay, I'm going to look at them and have them walk, watch them walk, see how they feel when they walk, do some functional tests, see how they feel and see how well they move with the functional test, do some range of motion and see how they do with that. Then I might take this patient and put them face down, and then look at the sacrum and palpate or push left upper, left middle, and left lower, right upper, left, right middle, right lower aspect of either side of that bone to see how well that bone moves. If it's springy, that's great. If I feel somewhere along there where it feels like a dead stop or a hard end feel, I know that's an area I want to treat. So utilizing functional mobilization for that patient face down, I would hold that spot down in the exact depth, angle, and direction of that tightness. Maintain that as they then face down, bend their knees up, and then rotate the feet back and forth like a windshield wiper. What they're doing is what we call lower trunk rotation. Face down, rotating back and forth. I'm holding that tightness down, and the pressure is on, pressure off, pressure on, pressure off, until I feel that start to melt away, ease up, and release until it's springy. After that, I would recheck, and maybe I'd find the second tightest area would be here. I would repeat that process, hold that tight spot down, they would rotate, and that would release. I would find that to be springy, and I would make sure the whole bone moved very well in a springy way back to front. That's just one technique. You might have the patient stand up, and maybe that takes 3 minutes or so. I have the patient stand up, recheck their walking, see if their walking quality is improved. Frequently it does. See if the pain is decreased with walking. Check the range of motion, see if that's changed. See if the pain has changed with range of motion. And their functional test, see if they've had some positive changes with that as well. Very frequently we see significant increases in mobility with a short treatment like that, and some improvement in pain as well with a short treatment like that. One reason this treatment is so effective is because you can be, as a therapist, very specific with your force. You can push exactly where that spot is tightest in the depth, direction, and angle that is tightest in. And when I can be that specific, I can really make a big change in a short period of time. And that's why this technique is so powerful. Again, my name is Mike Plackey. That's a short introduction to functional mobilization. My website is www.plackeypt.com. That's P as in Peter, L-A-C-H-Y, PT as in physicaltherapy.com. Phone number 916-221-8534. Have a great day, and thanks for watching.